2015 was a watershed year for the Grain Foods Foundation. We focused on reaching more influencers and consumers than ever before and highlighting the essential role that grain foods play in keeping us healthy, strong, and active. The Foundation's investment in data analysis yielded impressive results. Our work with Nutrition Impact proves the vital role grains play in nutrient delivery. We presented at some of the most prestigious conferences across the U.S. and Europe, receiving praise from the scientific and nutrition community, positioning GFF as a credible thought leader. To showcase the key findings, we created fun education materials for healthcare professionals, investors, and consumers alike. Heading into 2016, we anxiously await the publication of the findings in peer-reviewed journals, which we will utilize in our communications throughout the year. This work is an essential first step in expanding our future research initiatives and furthering our long-term goals. We strengthened our scientific advisory board with the addition of Dr. Richard Mattis. His experience will help us shape our message concerning grain consumption and America's obesity epidemic. Our scientific advisory board continued to provide the sound scientific underpinning of all of our messages, and their expertise led to multiple journal publications and media interviews throughout the year. Collectively, the board helped shape our comments for the 2015 Dietary Guidelines for Americans Committee, ensuring the most recent and compelling grain-based research was presented during the process. In 2015, we increased our presence on social media, engaging our audiences through innovative online campaigns. We introduced the world to Barb, our smart and sassy champion of grains. As a fictional character, Barb was able to poke fun at low-carb crazes and gluten-free diets with her one-of-a-kind wit, inviting fans and followers to stand up and share their love of grain foods. Barb generated record-setting levels of reach and engagement, achieving 600,000 impressions, 11,000 likes, 7,500 retweets, and more than 400 new fans and followers across social channels. Now that's something to get excited about. This fall, we enlisted our members on social to show how their products are baked with love. We shared 14 posts that garnered more than 25,000 impressions and nearly 5,000 engagements. Most importantly, it provided a behind-the-scenes look at the individuals that help make the products we love. GFF continued to deliver our messages and research insights to influencers throughout 2015. Working with advisory board member Dr. Suzanne Steinbaum, we filmed a segment for Focus on Health, which showcased how grains are an essential part of a healthy, balanced diet. We led a nutrition discussion featuring Dr. Steinbaum and registered dietitian Sylvia Melendez-Klinger in conjunction with American Heart Month, appearing in front of some of the top cardiology and heart health professionals in New York City. We continued to champion healthy babies by reinforcing the crucial impact that enriched flour has on preventing birth defects. We developed relationships with media, meeting with journalists one-on-one, providing insights into nutrition research and industry trends, combating fads and fiction by promoting the health and value of grain foods for everyone. And we showcased grains not only as a nutritional powerhouse, but also a source of memories, traditions, and love. For more than 10 years, the Grain Foods Foundation has championed wholesome goodness and common sense. Grains are good for us, and they bring people together to celebrate and to share. With new, compelling data, with the support of leaders from across the health spectrum, with the ability to reach and influence decision makers, with a focus on meeting consumers where they are, with messages that they are ready to hear, and with your support, the Grain Foods Foundation is poised to lead the industry and bring consumers back to the table, back to the products they know and love, for years and years to come.